So tuberculosis actually has what? Different patterns. Okay? Or you could say patterns, or you could say stages. All right? So we are basically trying to look at the spectrum. The spectrum, like, okay, this stage of tuberculosis, how far will it affect you? This stage of tuberculosis, to what range will it affect you? Which organs will be damaged in this stage? Which organs will be damaged in this stage? Okay, so that's what we actually say. That's what we call what? Spectrum of different clinical pathological patterns of what? Tuberculosis, right? So you have then primary tuberculosis, progressive primary tuberculosis, secondary tuberculosis, progressive secondary tuberculosis, disseminated tuberculosis, extrapulmonary tuberculosis, isolated organ, and the rest of them. So let's talk about the spectrum, okay? The characteristics of each stage. That's just the best way to put it. So for the pulmonary tuberculosis, you have the primary type. That's the primary tuberculosis. In the primary tuberculosis, you see things like the Ghon's complex. You see the HeLa word, lymphadenopathy. All right. Then for the secondary tuberculosis, you see things like what? Apical cavitary diseases and bronchiectasis. Okay. Then for the extrapulmonary tuberculosis, that's basically any type of tuberculosis that is leaving the lung tissues to affect any other organ in the body. That's what they say extra, outside the pulmonary tissues. That's outside the lungs. Okay. If it is affecting the pleural, that's pleural tuberculosis. There could be things like pleural effusion and empyema. If it is affecting lymph nodes, that's lymph node tuberculosis. It can affect what? It can lead to lymphadenopathy of the cervical lymph nodes, axillary lymph nodes, or inguinal lymph nodes, right? So that means the lymph nodes will swell up. Bone and joint tuberculosis. If it is affecting the spine, it can lead to Pott disease. It can affect what? The knee, causing arthritis. That's inflammation in the knee joint. It can, hip joint. It can affect the knee, causing inflammation of the what? Knee joint. Then talking about the genitourinary tuberculosis, it will involve what? Renal tract, bladder, reproductive tract involvement, okay? Basically, infect all these areas, okay? That's why having all those upper urinary tract infections, lower urinary tract infections, bladder infections, and all this stuff, right? Then gastrointestinal tuberculosis, that's when the tuberculosis have what? Gone outside the lungs to infect the gastrointestinal tract. So it can affect the intestines, peritoneal cavity, can affect what? The hepatic tissues too. That's the liver tissues. Then meningeal tuberculosis. This is when it is affecting the meninges, causing the meninges to become inflamed. And that's what we call a tuberculous what? Meningitis. Okay? So you can see that the primary tuberculosis, you can see a Ghon's complex. Alright, Ghon's complex. It's mostly seen in this type of thing. The disseminated tuberculosis. We said that this is when miliary tuberculosis, there's a widespread small nodules in the lungs, liver, spleen, or what? Bone marrow. Okay. Then tuberculosis sepsis. This is when there's bacteremia with multi-organ involvement. What is sepsis? Sepsis is when there's an infection in the blood, and this infection is causing your whole body to now start reacting to it. Okay, reacting adversely to it. That's just the best way to put it. Then immunological patterns. Tuberculoid. You have a well-defined granulomas. We've spoken about the type of granulomas that can be seen in tuberculosis, where we said that granulomas is just like your body's own way of trying to counter the microorganism, to contain them. Then lepromatous. This one is a poorly defined granulomas, but there's extensive necrosis, okay? Then histological patterns. You have cacheating granulomas, like central necrosis, epithelial cells, and giant cells. Then non-cacheating granulomas, you have no central necrosis, no epithelial cells, and no giant cells, right? So these are the various spectrum of different clinical pathological patterns of tuberculosis. You see this type of tuberculosis, you know that this and this and this will be found here, this and this effects will be found, and all this stuff, right? So that's it, and bye for now.